We originally were very interested in the prevalence of obesity or change in the prevalence of obesity, and we were told that, well, don't use that. I mean, nobody knows what a prevalence is, but people know what cases are. The net cost, which is the cost of implementing the intervention minus the healthcare cost savings. So a negative number means that an intervention is actually cost savings. But there aren't many interventions like this, by the way, cost-saving interventions. And then a metric here, which is the healthcare cost saved per dollar invested. People like that. So we've estimated this model for the United States. Again, first take 1 million people, representative of the US, and then you project what's happening to them with their growth over the next decade. We get results, and then we repeat that 1,000 times with all the uncertainty around those estimates I just showed you, and then we get our estimates of where we're headed and what a sugar-sweetened beverage excise tax will do. It will reach roughly 300 million people. People don't consume beverages, of course. It's not going to make much difference for them, but we take all that into account. We predict that this tax would prevent about 630,000 cases of childhood obesity. We picked one particular year because it'll vary a bit from year to year. If you add adult obesity, it's about 2.5 million cases prevented in that given year. Net cost savings of about $14.2 billion. And by the way, when we're talking about the savings, that's not talking about the revenue from the tax. I mean, that's a totally separate issue that you don't consider in the cost effectiveness analysis. It's just the projected healthcare cost savings because you have a lower prevalence of obesity, and individuals with obesity, particularly older individuals, have much higher healthcare cost. Healthcare cost savings per dollar invested would be about $30 for every dollar invested. We predict there'll be about 37,000 deaths averted over this 10-year period. 580,000 quality-adjusted life years gained, 150,000 years of life gained, avert 15 million obese years. This is years that people live with obesity. And the obesity percent reduction is just about 0.8%, less than 1%. So if the prevalence of obesity in the US among adults is 39%, you know, it's going to drop it a little bit, not even a whole percent. And that's why when we talk about what we need to do about obesity in this country, we always talk about we need to have multiple interventions throughout the life course that do a range of things, and a sugar-sweetened beverage excise tax is one of those things that can make a difference. I mean, again, it's remarkable. It's a cost-saving intervention. I'm now just going to contrast a sugary beverage excise tax with just a couple of other interventions, just to place it in context, because I think it's one of the more important things we've been able to do with our microsimulation model is it's kind of a level playing field that you can use to compare a lot of different interventions. And if you do, well, how does a sugary beverage excise tax stack up among different interventions? A couple of interesting ones here. Smart Stacks, which is part of the Healthy Hunger Free Kids Act. It basically eliminates junk foods and beverages during the school day outside of lunch. Bariatric surgery is an interesting one because it has big effects on BMI. And here we just modeled out what would happen if you had a fourfold increase in the implementation of bariatric surgery among eligible adolescents with obesity, actually severe obesity. It's interesting, as I mentioned, with a sugar-sweetened beverage excise tax nationwide, you get these results. Smart Snacks is actually another cost-saving intervention. It's actually really inexpensive to implement. There's nice evidence from change studies of its likely impact. Bariatric surgery is interesting because you have very big effect sizes. Adolescents who receive bariatric surgery you'll see a decline in BMI of about 14.5 BMI units, but they begin with an average BMI of 50. So they've ended up with a BMI of 35, so they still have severe obesity. You haven't prevented any cases of obesity. We think it's likely an important intervention for many adolescents with severe obesity. But the other thing about it is not that many adolescents with severe obesity get the procedure in a given year. It's just a couple per thousand. So there's big effect, but the kids have very severe obesity to begin with, not a large reach at the intervention. It's fairly costly relative to other interventions, and so it has no impact on cases of obesity. It's too little, too late, and that's true of a lot of treatment. And again, if we look at the healthcare cost savings per dollar invested in SSB tax, smart snacks, both save more than they cost to implement. I mean, really kind of remarkable interventions in that sense. We've also looked at the likely impact of a sugary beverage excise tax on differences in the prevalence of obesity by race, ethnicity. And this is a study we did of what would likely happen with children. Because children who are Hispanic and Black tend to consume more sugary beverages than children who are non-Hispanic white, we'd see a greater change in obesity prevalence among those groups, and so disparities would tend to lessen with this tax. And the same thing is true by income level. You'll see a little bit of a reduction in disparities because of the fact that children who are living in poverty and lower income levels tend to consume more at baseline, and so they'll respond more to the tax. Now, one thing that I think is useful to put in perspective here, and I haven't seen it discussed yet, how much do people in the U.S. spend on sugary beverages? We use the Red Center estimates and calculate that people in the U.S. spend about $105 billion per year on tobacco. That's a lot of money. So when we think of why it's so hard to change this habit, it's not just because we have this inborn biology, but because there's a lot of money on the table to be made. In contrast, tobacco is about $80 billion a year. So when we talk about big sugary beverage, yeah, it's like big sugary beverage and big tobacco. If we just average this across the population per capita, so people are spending about $340 a week on sugary beverages, and so a 1% tax would be about $1 per week. Now, people that consume more would have to pay more, but that's for the level of the tax we're talking about here. And one interesting thing about this tax is that because of the price elasticity, with the tax, people will spend more or spend less on sugary beverages after the tax, even including the tax, than they were before. So they're spending less on something that is killing them, which slowly, but I think that's good. There's this phrase that we hear a lot, regressive tax. I actually think it's something that economists mean by this phrase is just the tax is a proportion of a person's income. And it's certainly true that $1 a week is a greater proportion of income for a poor versus a wealthy person. I mean, that's why this phrase regressive is used. But as Ken Warner is noted for tobacco and Larry Summers for sugary beverages, the health effects of these habits are regressive. And we need to consider more than just this certain proportion, this dollar divided by your income is what's important about a tax, because actually the health effects of the tax will be progressive. And that's assuming that the impact of the tax is the same across different parts of the population. I think Barry Popkin has noted this. In Mexico, in their study there, they found that among the lower income part of the population, there was a greater change with the tax compared to the higher income part of the population. And we still have to find out what's happening here in the U.S. in that realm. But if that happens, then the tax would be even more progressive in a sense in terms of its outcomes. Now, independent of all that, well, there's all this revenue, which is projected maybe $14 billion per year. It's true that some people can just not pay the tax. You know, there's a whole literature on tax evasion and gas taxes, for example. Yet the cities and states that have collected excise taxes already have collected a lot of money, and they tend to do a pretty good job. And this revenue could be allocated to progressive programs, you know, unrelated to obesity, or in programs that target inequities in childhood and adult obesity prevalence by race, ethnicity, or income. It's interesting, in Philadelphia, the part of the sale here was to use the dollars to expand early care and education slots, which is not a bad way to spend this money. I know when we were working with the health department in the state of New Hampshire, people were stunned to realize that a sugary beverage tax in New Hampshire could have a huge impact on opening up early care and education opportunities in that state. In fact, it's true in just about every state. So we have projected the impact of sugar-sweetened beverage excise taxes for many cities and states. And in general, well, the way this plays out, given all the assumptions and the literature that we've used, higher taxes are projected to have higher health impact. They generate more future healthcare cost savings and more revenue, actually. The revenue seems to max out at about 2 cents per ounce, but again, this will be an empirical thing to look at in the future. I think, let's say, Philadelphia is $1.70 or a cent, 1.75 cents, which is like Seattle, except Seattle's only taxing healthy beverages, whereas Philadelphia is both sugary beverages and non-caloric sweeteners. We do assume, based on the literature, that if you tax both sugar-sweetened beverages and the non-caloric beverages, that you'll have less of a health impact, because basically you're taking away an option for people. You know, it's folks want to buy a non-caloric beverage, well, it's the same price, and so it becomes less of an option. We have also modeled out the impact on dental caries and dental cost. I think someone yesterday was talking about that, and there is a whole literature on this. If you, marinate your teeth in sugary beverages during the day, you'll create cavities, and those cost money. And there's a beautiful literature on that of how that works. Brush and floss every day, folks. So, in summary, a sugar-sweetened beverage excise tax is projected to reduce childhood and adult obesity prevalence across the population. And again, reduce relative to the counterfactual of where we're headed. At very low cost, it's projected to be a cost-saving intervention. And as we work with different states and cities looking at different interventions, I mean, even that cost will vary from place to place. For example, right now,